So, acid reflux is a problem that it looked like everybody in the room just about has had to deal with at one time or another. It's something that we think of as just a part of life, and it's something that, you eat a spicy meal or, stressed out, something like that, you start feeling bad, and it's just something you have to deal with. And that's not really true. Let's see if this thing works. There we go. What is acid reflux? It's not just a burning in your chest. It's not just a symptom or something that you feel. It really is a problem that, can cause you further difficulty down the line, and it is a problem that we can help, take care of for you. Acid reflux, as it says up here, is basically when the acid that your stomach makes backs up and goes into your esophagus, sometimes all the way up into your mouth, and you kind of taste that brackish, nasty taste in your mouth. And it goes up and down, and it doesn't stay where it belongs. And that's what causes you to feel bad. It's what causes that burning feeling behind your chest, what makes you get that sour taste in your mouth. A lot of people have heartburn. 60 million people is what they've kind of come up with when they studied it. That's about 1 in 5 people in this country have real problems with heartburn. And 15 million people in the country have heartburn on a daily basis. I personally have that problem, so I know the torture of having heartburn every day. It's a real big deal and can really limit your life. It can also cause some pretty serious complications that we'll talk about later. There's just a picture, so you can kind of see the way it works. Right here, you've got your esophagus, and right here is your stomach. And your stomach makes the acid. Right in between, there's something called the lower esophageal sphincter. And that thing's supposed to close up real tight whenever you have a meal, whenever you eat, your stomach's trying to digest and squeeze that food. And sometimes it doesn't. Sometimes it stays too open, and everything backs up and causes you to hurt and feel bad. So that's what acid reflux is. Now there's another thing I've probably heard of called Gerd, which is gastroesophageal reflux disease. It is essentially when you have reflux and it causes troublesome symptoms or complications. So some people have some reflux now and again that doesn't really bother them, and that's not what we would call Gerd. Gerd is when you have problems every day, you have pain, when it makes you avoid certain foods and activities that you want to, be engaged in. And it can also cause complications. So a lot of people have something called silent reflux, where they don't feel the burn, but maybe you have a cough all the time, maybe you have some asthma that nobody can really explain, maybe you have a lot of cavities because the acid gets up in your mouth and erodes your teeth. It can cause you to have something called esophagitis, which is just inflammation of the esophagus because that acid is where it doesn't belong. That can lead to strictures in the esophagus, which is scar tissue. It squeezes it tight, makes it hard to swallow food. You feel like you got a lump in your throat or food sticks on the way down. You can even get something called Barrett's esophagus, which is a condition where the wrong types of cells start to grow in your esophagus. Because the body doesn't think that acid belongs in the esophagus. So when it starts experiencing it on a daily basis, it starts trying to protect itself by growing new kinds of tissue. Unfortunately, it doesn't belong in the esophagus, and sometimes it can go overboard and actually turn into an esophageal cancer. We don't want that. That's a bad problem. So acid reflux and Gerd are more significant in some people than just my chest hurts, I can't eat spicy foods. It can cause real problems. Some of the things that can make it worse are listed up here. Some of the things that we can avoid ourselves: smoking, sodium intake, obesity, certain medications, and alcohol and coffee can really kind of exacerbate that reflux. Coffee is real bad. Caffeine can cause it. Chocolate can really kind of, who doesn't like chocolate? But it can cause your reflux to get worse. Obesity is a problem. It causes extra pressure on your belly, and it kind of helps to squeeze the acid up. And so those are some things that you can kind of work on as a lifestyle to feel better. Some of the symptoms of Gerd that you might not think about being related to reflux are things like I said about dry cough, wheezing, asthma, You have some nausea and vomiting, regurgitation. So when you eat a meal, 15, 20 minutes later, you kind of have that little burp, and food comes back up in your stomach. You have to swallow it in your mouth. You have to swallow it again. It's not fun. Chest pain, bad breath. Those are all things that can be caused by reflux that are not the typical, pain in my chest and burning sensation. And then there's a number of things you can do to treat it, try to feel better. We always like to start off with lifestyle changes, and we'll talk about all these in a minute. But that's kind of where you start, and then you can move to medications. And a lot of people are on medications for this. And then there's even surgical options to try to take care of reflux and get rid of it permanently. Not a lot of people know that that's an option, and I'll kind of want to share that with you guys a little bit today, so that you know what the full range of possibilities are to take care of it. We talk about lifestyle changes. Avoiding some of those things that can cause reflux are important. Smoking, alcohol, caffeine. If you have a bad problem with reflux, if you're feeling the burn every day, cut back on those things. Losing weight, everybody talks about losing weight. It's real easy to do, right? Nobody's ever dieted and lost some weight, gained some weight. We talk about it. It's tough, but it really does help. And then, for people who have reflux at night, you lay down in bed, throat stops burning, you have to take the Tums. You can actually change your bed a little bit, and it can help because you can use gravity to your advantage. So if you're having that problem at night, a lot of people will stack up pillows under their head and try to lift their body up. It actually doesn't work that well, and the reason is when you bend over at the waist, you squeeze, right? And that squeeze will push acid up and make it worse. So pillows under the head, 3-4 pillows under the back, things like that, actually can make it a little bit worse, but it's the right idea. What you want to do is go to, Bed Bath & Beyond, Walmart, or somewhere like that, and get bed risers. They're really made for people who want to loft their bed, put stuff underneath it, but if you just put one under the legs on the head of the bed, kind of make it tip at about a 10-degree angle, it really can help out a lot. You lay flat in bed so you're not squeezing, but gravity will help kind of pull it down. So those are some things you can do at home just to kind of, help out with some of those symptoms. The next kind of step is medications. Everybody's taking the Tums, and those are great for, occasional heartburn problems. So, you have that gumbo or, the fried chicken. Nobody ate fried chicken today. You have some fried chicken, and maybe you get a little heartburn, you can take some Tums, soothe the stomach. It doesn't do anything to slow down the acid production in your stomach, but it kind of neutralizes it and makes you feel better. So if you're having heartburn once a week, once a month, something triggers it, antacids are a great solution for that. They'll really, take care of, the problem in the moment. The next thing you can kind of step up to if you need to are the H2 blockers. These are the Zantacs, the Pepsids, the things like that. They've been around for a little while now, and those are the ones, if you go to the grocery store, to the pharmacy, and you look at the heartburn section, you'll see there's expensive medicine and cheap medicine. The Zantacs, the H2 blockers are the cheap medicine. And, this is because they've been around for longer, but they really do work pretty well. And they work by blocking some of the acid production. They kind of trick your stomach into not realizing your brain's asking for acid, and they slow it down. They don't eliminate acid production, but they can really, help with symptoms. And a lot of people get good effect from that. About 50% of people with frequent heartburn, daily heartburn, things like that will get pretty good relief from an H2 blocker. Downside of it is most of them you have to take twice a day, and they don't tend to have a whole lot of overlap. So what I mean by that is if you take one at 8 o'clock in the morning, then by 8 o'clock in the afternoon, if you have to take your next dose, you're probably going to have some breakthrough symptoms. So you really have to kind of be on the ball about the timing of your medication with those to have real good effects. And like I said, about 50% of people will respond to that pretty well. The other 50% will not, and for those people, I would recommend the proton pump inhibitors. That's the Prilosec, Nexium, Prevacid, omeprazole, those sorts of medications. They work a little bit differently in the stomach. They really, really clamp down on the acid production. They can often even make it where your stomach makes basically no acid at all. You still digest your food okay, but it really will help with those symptoms. Those are also good medications if you've been diagnosed with an ulcer. They can help to heal that ulcer, because you really want to get the acid down to zero if possible if you have an ulcer to heal it. So if you've ever been to the gastroenterologist, they told you you had an ulcer or something like that, they probably put you on a PPI to help that heal. So, TV, right? Lawyers like to get on TV and talk about things. News likes to get on TV and talk about things that may be dangerous. And the PPIs have really taken a hit recently in the news. There have been several studies about these medicines. And, you know, the truth is, if you're taking these short term, there's basically no risks. Nothing to worry about. Take it if you need it. So if you have episodic, occasional heartburn and you want to take a PPI for that for like a week, and that's what the back of the box says, right? It says take for no more than $14 without talking to your doctor. And, if you're taking it like that, there's really no risk at all in taking a proton pump inhibitor. If you have an ulcer and your gastroenterologist wants you to take one to heal the ulcer, take it. No problem. The long-term effects are what people are a little bit more worried about. These are the people who are taking, this daily for years and years, and it's just part of their lifestyle now. They have reflux all the time, and if they don't take their medicine, they're miserable, and so they take it every day forever. And there have been some studies that show some concerns about that strategy, because it does suppress your acid, and that acid is supposed to be there. There have been, studies that show increased risk in what's called C. difficile colitis, which is a bad colon infection that can be very serious or life-threatening. Stroke, pneumonia, dementia, kidney disease, electrolyte problems, osteoporosis. These have all been linked to use of PPIs. There was even a study not too long ago that said that there's an increased risk of all-cause death for people who take a PPI compared to people who take the H2 blockers like Zantac. Now, what does that mean? Does that mean that if you take it, you're going to die? No, it doesn't. Basically, they took hundreds of thousands of people who were taking these medicines, and they looked at who died for any reason. So if they got hit by a car and they were on a PPI, it got blamed on the PPI. So these numbers this is very weak evidence. This doesn't tell me, we need to take this stuff off the market, or nobody should take it. It just means there's some questions out there that they're still working on figuring out whether there's any danger or not. So I don't want to scare people into not taking PPIs, but I know you've seen it on TV, you're going to ask questions later, so I put the slide in there just to kind of hit that off in the pass. Also, these numbers are very small. When they did this study in particular, they claimed that people who use PPIs have a 50% increased risk of death compared to people who are on an H2 blocker. Well, 50%, that doesn't mean 50% of people died. It means that 50% more people died. And when you look at the numbers, it's like saying if 2 people taking an H2 blocker out of 100,000 died in a 5-year period, well, 3 people in the PPI group did. The numbers are very small, it's just the percentage looks really big. So when y'all look at the news, you look at the lawyer ads, things like that, just kind of keep that in the back of your mind. There is question, but it's not as bad as they want to make it sound. If you need to take it, I would recommend taking it. That being said, PPIs don't fix the actual problem. They fix the symptoms. They suppress the acid, but the issue causing the reflux is still there. So if you want to fix the problem itself, there is a surgical option. It's called a laparoscopic fundoplication. Basically what this does is it tightens up that weak sphincter that's causing things to go back. I'll go back up just a few slides and show you that again. So again, the problem with reflux is that you've got this muscle that's supposed to be tight. It's supposed to keep everything in the stomach, and it's not tight enough, and it lets stuff up. Now, you can block acid all day long, that thing's still floppy, and so it's not going to help with the regurgitation. If you have the food come up, it might not burn as much, but it's still going to come up, on the medicine. It's not going to help that much if you're one of these people who wakes up in the middle of the night choking, because some people do that. Again, the acid may not be there, but the fluid still comes up and it's still going to give you the trouble. So the medication's not going to help with those issues. Really, the only thing that's going to help with those is fixing the problem, which is that loose muscle. So if we do the operation, It's a laparoscopic procedure. It is basically, you might have heard of a stomach wrap. That's basically what we're doing. We use the muscle and wrap it around the esophagus, or this muscle of the stomach and wrap it around the esophagus, and that squeezes it and tightens it up. And what it does is when your stomach starts trying to digest food, and the muscles of the stomach contract and start trying to grind it up, well, guess what? That little section of the muscle or the stomach tightens up too, and it closes up the esophagus and it reinforces it so stuff doesn't back up. This is a pretty straightforward operation to have if you decide that you wanted to have it done. It's done laparoscopically with about 5 incisions, less than an inch. Takes about an hour and a half to do, and it's got really good results. We see about 70–80% of people are able to go completely off of acid medicine, and the rest typically, go from daily users to occasional users. So it really can help people out a lot. That's a picture. It's a little light, but just so you can kind of see what's done on the inside. It's very simple. It's basically a couple of stitches. This is your stomach. The esophagus is kind of coming down out of the chest right here, and the stomach is just wrapped around and stitched. And then the body kind of scars that in later. Another good picture. It tightens it up. It doesn't make it smaller like a gastric bypass or something does. It just kind of wraps it around to improve the squeeze. Oh yeah, you can still eat okay. Now, here's another picture. This person also had something called a hiatus hernia, which is where the stomach can slip up into the chest, and that can cause symptoms as well. So this particular person had a repair of that hernia and the stomach wrap. And you can see it's just a couple of stitches. It's not a huge operation. You have to kind of mobilize things so that we can work with it, but there's not a bunch of plumbing that we reroute or anything like that. Here's a picture from the inside, just so you can get an idea of what it looks like. And this big black thing you see in the pictures is an endoscope. So if you've ever had a scope down looking at your stomach, that's what it looks like. And you can see here, this is what it's supposed to look like on the inside. Everything's wrapped real tightly around the scope. This is where the esophagus joins the stomach. Then as you kind of get worse, it kind of gets gap, and it gets a big gap, and then you've just got it completely loose and open there. And those people, this is a picture of somebody with an actual hiatus hernia like that last picture showed. If this person, either one of these people are probably experiencing pretty significant reflux just because everything's loose and coming up. And that's what we're trying to fix with surgery. And here's a before and after. This person had bad reflux, and they had a big open, sphincter, and then they had the stomach wrap done, and you can see. Nice and tight, wrapped around the scope. And that's going to help to keep all of that acid where it belongs. So we can get to that in a second. Having surgery for this problem, it's like I said, a pretty straightforward operation. Most people are very, very happy with it. The one thing that people sometimes don't like about having this stomach wrap done is you can't burp, at least not right away, because it does tighten things up. So if you love your fizzy drinks, if you love your pop, I'm not from the north, I don't know why I said pop, but you can get a little bloated, and you can have a little bit, and you got to pass it down and out. You can't burp it up. So early on after you have surgery, that can be a little bit of an issue. If you want to burp, you can't burp very well. Usually, 6 months to a year after you've had the operation, things have loosened up a little bit. It doesn't, continue to be that much of a problem. But, that's one of the main complaints you have. You can't burp, and then, if you get a little bad stomach bug for some reason, and you need to throw up, it can be a little hard to throw up for the same reason. You might do some dry heaving and kind of feel bad, and it just won't come out. Most people, by 6 months to a year after surgery, that's kind of gone away. But that is something that some people who, I guess, throw up a lot complain about. The other thing, some people do feel a little bit of food sticky as it goes down early on after the operation. And that's just while everything's healing. It's tight. You're not used to it being tight because it never was. And so you can feel that sensation of the food kind of sticking and going down. And again, that's something that goes away pretty soon after surgery. But just so you know, it's not entirely without some side effects, but the majority of people who are talking to us about having an operation for reflux, the reflux is making measurable. And these are very minimal trade-offs to deal with. Just wanted to reintroduce ourselves to you guys. We haven't been here in about a year or two. Dr. Campos, myself, and Dr. Murad are here. I'm the youngest in town. I've only been here 2 years. The other guy's been here, over a decade, and I think everybody knows those guys and does a good job. Tinsley is new to us. Just been here a month. Yeah, she's been here for a month, and she's helping us out a lot, really helping us kind of coordinate care and make sure everybody's being taken care of in the hospital. Time if you've never been in and you're in the hospital waiting to talk to us and we're in the operating room all day, sometimes it can be annoying, and she's really helping out with making sure questions are answered and things like that, and really doing a great job for us. Some of the things that we do, Wi-Fi traffic, as we talked about that in a minute ago. We do a lot of things. We do a lot of laparoscopic, advanced minimally invasive surgery, gastroesophageal surgery, EGDs, which is stomach scopes, and colonoscopies. So if you need a screening colonoscopy for colon cancer and things like that, if you're having heartburn, we can do those scopes for you. We do chest surgery, so if you've got a nodule on your lung or a bad pneumonia or something like that, we actually do an operation for that, and we can offer those services. Wound care, there's a lot of people walking around out there with these wounds that won't heal. We really enjoy taking care of those and trying to help you get those things healed up. Breast surgery, the gamut, just lumps, lesions, biopsies to breast cancer, and lumpectomies and lymph node biopsies. We can take care of that for you. Thyroid surgery, hernia surgery, cancer surgery. We don't do all cancer surgery. If you need to have your liver taken out or something, probably going to let them do that up at a big hospital. But the majority of stuff, we can take care of for you, and we're happy to do so. And with that, I'd like to answer any questions you may have. Yes, ma'am?
Yeah,
The laryngopharyngeal reflux, I'm sure I said that wrong. But that's the condition that I was mentioning earlier, where you have a lot of reflux, and it may not burn, you may not have that sensation, but the fumes come up into your throat. They cause your have cough, wheezing, asthma, dental problems, things like that. And sometimes some acid medicine will help with that. If it's just the fumes coming up, if it's just the acid, but if the acid medicine is not taking care of all the problems, then you may have that regurgitation issue and tightening things up might help with that.
Okay, hold on. So everybody can hear.
Oh, I'm sorry.
The main foods we should avoid, and when should we take our omeprazole? An hour before breakfast? How much? That's what I take mine.
Yes, ma'am. That's perfect. So the question was, what foods make reflux worse, and when should you take your omeprazole if you're taking it? The foods are going to be kind of dependent on you. Everybody reacts to things differently. Spicy foods, tomatoes, chocolate, caffeine, alcohol, peppermint, yes ma'am. Those sorts of things can really exacerbate the reflux. Some people, it's other things though, but those seem to be the main things. And you're absolutely right. You want to take it in the morning as soon as you get up and about half an hour before you eat breakfast. If you're one of those lucky people who need to take it twice a day, then you're going to want to take your first dose in the morning about half an hour before breakfast, the second dose about half an hour before supper. Don't wait until bedtime. So aspirin is in a class of drugs called non-steroidal anti-inflammatory drugs. Aspirin, ibuprofen, Aleve, those sorts of medications. They don't increase your acid production, but what they do is suppress the mucus production in your stomach. So they can increase the chances of you getting an ulcer, but they don't necessarily contribute to reflux.
Take 81 milligrams every night.
Yes, ma'am. Yes, ma'am. And if you've got a reason for your heart or something like that to be taking the aspirin, I never am going to tell you not to take an aspirin for your heart because that's important. But no, it should contribute to the actual reflux.
Do you do tests to determine whether this surgery is needed, or you just take the patient's word?
So it depends. Sometimes patients have such a classic picture that you can take their word. Somebody comes to me and says, I have pain every day, burning in my chest, I lay down at night and my food comes up in my mouth. If their story is just classic and obvious, then I think you can take the patient at their word. Now, you may still want to do a test to make sure there's nothing else going on. And that test would be to do a scope and look at the esophagus. Because we do want to know ahead of time if you might already have a problem like that Barrett's esophagus, or even, hopefully not, but esophageal cancer or something like that has already started cropping up. We want to know about that ahead of time before we start talking about surgery. For somebody whose story is not quite as clear, but we have a high suspicion that they have reflux that may help, then we can do a scope and we can look for evidence like esophagitis, irritation of the esophagus. We can see if they have a hiatus hernia that may be contributing to it. That's when the stomach comes up into the chest. We can look for ulcers, test for infections of the stomach that may be causing it. We'll other things. Yes, ma'am. It can cause you a lot of drainage, absolutely. For people who that scope doesn't really tell you, there's also some tests you can do called a Bravo, which is 24-hour acid monitoring. And basically, you get a little pill stapled on the inside of your esophagus. It's not really stapled, it's just kind of suctioned in place. And then you wear a pack on your hip. It's got a little button on it, and you walk around, and when you feel it heartburn, you push the button. When you feel a symptom, you push the button. And over the course of 24 to 48 hours, eventually it just kind of falls off and you pass it in your stool. But you take that box with you, they look at it, they look at all the data, and it actually measures the acid that gets up into your esophagus. And so they can look at it and say, well, how much time in the day did you have acid in your esophagus? Did those spikes in your acid match up with when you push the button and get symptoms? And you can kind of figure out if that's what's causing your symptoms or if it's something else. So the answer to your question is yes, yes, and yes. Sometimes people have just such a great story that you can say, you know what, we'll talk about surgery. Sometimes people need a little bit more testing to make sure that that's really going to help them before we do it. Yes, ma'am.
What if, say at night, if you sleep on pillows, but you slide off, and you kind of be just level lying there, and you wake up in the middle of the night, say about 3 or 4 o'clock, and your stomach it's growling, it's cutting up. And then your heart starts beating real fast and your blood pressure goes up.
Well, that's a lot of stuff.
Yeah, that's a lot of stuff. And your blood pressure goes up, sometimes your heart rate it spikes to 130, something like that. And you have a hyena hernia also. Now, what can be done? And you taking protonine, 40 milligrams, but you've been taking that for so long, it seems like it just lasts, and it doesn't even help you.
Yes, ma'am.
You've been taking it for over 10 years. Like, it's just not helping.
And that's exactly what we see with some people is, I've been taking this medicine for 10 years and it doesn't work anymore. Or I've been taking this medicine for 10 years and it never really did much for me. And those are people who might, really benefit from a look at it, whether, surgery might help them. Not everybody is a good candidate for surgery, but a lot of people with those sorts of problems, might be really helped by it. Nothing else is helping, right? Now, as far as your blood pressure going up and your heart rate and things like that, any number of things could cause those problems. I don't want to blame it on reflux. But yeah, if you've got, problems with